He said, I'm sorry, I have bad news. You have small B cell lymphocytic lymphoma. Well, so I hear lymphoma and I just know that, yeah, it's cancer, right? And so I started crying and I asked him if I was going to die. I wasn't really like prepared, and maybe like probably no one ever is, right? For that, but and I'm getting upset talking about it because whoa. But yeah, it was 3 p.m. on January 15th. I was expecting this call from the doctor, and I told my sister that I was having that call and another friend, and that I'd get back to them after. And of course, I was home because it was COVID. And so when the phone rang, it was again Dr. T, the guy who hadn't believed me. And this time his tone was different. So right away, I was like, okay, this isn't going to be good, because his tone before had always basically been really dismissive and treated me like I was crazy. And then this time he sounded really serious. And he asked me if I was at home, and I said yes. And then he asked me if I was alone, and I said yes. And then I think he asked me if I was sitting down, and I was like, yeah. And so like I knew, like, okay, I have something bad. What's he going to tell me? He said, I'm sorry, I have bad news. You have small B cell lymphocytic lymphoma. Well, so I hear lymphoma and I just know that, yeah, it's cancer, right? And so I started crying and I asked him if I was going to die. And he said, no, you won't die. He didn't really tell me anything about the illness. He just said, I'm now referring you to a hematologist at the BC Cancer Agency, and they'll call you next week. And then I told him, I said, I really hope that you did everything that you did as fast as you could to get this done. Like basically telling him without directly saying, like, I know you didn't believe me and I hope you didn't like mess up or whatever. And he said, oh, you don't know. He said, you don't know how many calls I made on your behalf to try and speed things up and blah, 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 blah. And I don't really believe any of that for a second. So then I was waiting for the hematologist to call me on Monday, like he said, and my phone didn't ring. And then I think I waited till Tuesday and it still didn't. And then by Wednesday, I hadn't heard from anybody. And so I phoned, and I guess the fax referral hadn't gone through. I phoned him back and said, I didn't get that referral you said they were going to do. Can you please tell me the doctor's name, the hematologist, so I can phone and find out what's up? And he gave me the name, and I called their office, and I guess the fax hadn't gone through. So, but then that finally happened. After that phone call with the doctor who told me the diagnosis, the internist, I was like bawling. But after I hung up the phone, I was actually walking around my apartment saying out loud, I'm not crazy. I'm not crazy. I'm not crazy. Like, I'm not crazy. I knew it. So I was like, yeah, upset to find out that, yes, I do have lymphoma, which is what I suspected. But I also was like, I felt a sense of like vindication. Like now I can tell all these people who didn't believe me that I'm not crazy, and that, you know, basically they were unhelpful. So they were all in shock. A couple of people apologized to me. Like my sister even said, she said, wow, we thought like you were just under a lot of stress because of like other things in your life. And yeah, my coworker said she said, I'm sorry. We just thought you were like overreacting and whatever. And I was like, no.
Thank you, Nadia, for sharing all of that. It's, I'm sure, not easy to go through all over again. January 21st, so not too long after you get the diagnosis, you have your first hematologist appointment, which was, as you said, your 46th birthday. So not the kind of birthday I'm sure that you were looking for, but
Right.
describe what that first meeting was like in terms of understanding, okay, where do we go? Now we have a diagnosis, SLL. Where do we go from
Yeah.
here?
So I was relieved because I think that first phone appointment was an hour long. I spoke to an assistant and then the actual doctor, and they asked me a million questions and my whole history and my symptoms from whenever. And I just was like, felt relieved that like finally now people believed me and wanted to know. So there was that. And it was just me answering a lot of questions about my history for an hour, and they didn't really tell me a lot like about the illness, but they just said, here's next steps. They said they needed to do a bone marrow biopsy to determine bone marrow involvement, and that shocked me because I was thinking like it hadn't occurred to me that it might be in my bone marrow. And then of course I got terrified of that procedure, but they told me bone marrow biopsy and genetic tests on the cancer cells themselves. And then they wanted to do a follow-up CT scan to compare to the one from 4 months before to see what change there may have been in the lymph nodes, and that they needed to do all of this before I start treatment.
And then a couple of weeks later, they gave the report back about the bone marrow involvement. Can you talk about the results and how they said, well, and now this is the staging, and here's what we need to do next to treat you?
They told me that I had 40% bone marrow involvement, and I was stunned. But then I thought, oh, that's why like my knees were burning maybe, or my hip pain. I was like, that explains some things. So they told me that. They told me that the CT scan showed that like my lymph nodes were enlarging quite rapidly from the previous 4 months. And they didn't tell me any of the results of the genetic tests. And they just told me that like I needed to start treatment right away. They just said like, you're pretty sick, you need to get treatment right away. I asked the doctor, and they said my only option was chemotherapy, right? FCR chemotherapy. And I said to the doctor, okay, like because I had read this, I said, before we start chemo, like, or treatment, can you just get a second opinion on the diagnosis to be sure? And so I got that second opinion on the diagnosis on February 17th. And they told me that the guy who reviewed it added an addendum that it was a particular, they call it accelerated SLL.
Can I ask the second opinion, because you asked the doctor, your hematologist, to give the second opinion, was it from the same hospital?
Same hospital, but different pathologist.
Doctor.
Yeah, different doctor that looked at it. And he said, in his opinion, it fit the criteria for accelerated SLL, which they call histologically aggressive. And the other thing that I saw, because at that point, I think I requested a copy of my test results so I could see. And then it also mentioned that I had unmutated IGHV, which carries the poor prognosis. So in my brain, those two things went off. Okay, it's aggressive, and I have this IGHV unmutated thing, which isn't good.
Yeah, but the second opinion didn't change. There was no like, oh, we shouldn't do FCR. It was still going. Okay.
No, it's like we should do FCR. And so I told the doctor I was terrified, like the hematologist at this point, that I was pretty scared of that and wasn't sure that I wanted to do it. He said that he would follow up with me towards the end of February, I guess. And in this interim of a couple of weeks, I did some more reading because nobody really told me much of anything. And that's when I found out what IGHV unmutated status really means, and how chemotherapy, like FCR chemotherapy, is not so effective for that. And I also found out that in many other jurisdictions, as well as other provinces in the country that I live in, which is Canada, that they're no longer doing FCR in cases of IGHV unmutated status, because they know that it's not effective and you have a quick relapse. And in fact, it can cause further mutations and more aggressive illness. So I read all that.
You don't have some scientific background or anything, but you did reading and you did research and you found all of this in that research. Yeah. And I'd love to highlight what your hematologist said when you told him all this stuff.
Right. And I just want to tell you, I was doing my master's in English at the time, and I'm like, research is one of my strong skills, right? So I was doing it, and I'm used to reading academia, right? I was reading medical journals, but yeah. So I told the hematologist that, like, okay, so from everything that I just read, FCR is like no longer really recommended for IGHV mutated status. Pretty much most of the other provinces in Canada now recognize this, and they approve this drug called ibrutinib as first line treatment for people with IGHV unmutated status and other markers. And I told him that I didn't want to do chemo because I had read that and that didn't think it was the right thing. And he told me that he told me two things. He said that he doesn't have time to read studies and that I read too much, is what he told me. So I think that appointment with him was on February 25th, where he told me that stuff about not having time to read and me reading too much. And then, okay, we'll set this date for chemo on March 16th. And as that date was approaching, I felt like I was being sent to like the electric chair. Like I knew that this is not what I should have. And then I phoned the cancer agency back and told the nurse that I didn't think that they were following a very trauma-informed approach, and that I was being forced to do something that wasn't right for me. That was basically, I told them it was further increasing the trauma that I already had from not being believed. And that nurse said, yeah, I think you have medical PTSD is basically what she said. But anyway, she hung up the phone. She went to talk to the doctor, and an hour later, my phone rang, and it was the doctor. And he said, I'll apply for special funding for ibrutinib for you.
He also said something about you wouldn't qualify for the ibrutinib funding, right? And that if you didn't get treatment, you would die. Is that right?
He said it's hard to know, but he said if you don't get treatment, I'd give you a year, give or take, that I would die. And he told me that the only other case where he'd applied for ibrutinib funding for a patient was where that patient lived in a really remote area of the province, so they couldn't access a treatment center for chemo. But I also told them, I said, look, like I have this high risk factor. I've already been through what I've been through. I know that that's not the right treatment, and you're going to tell me it's my only option. And I just like basically said, yeah. So now I'm having more trauma and whatever. And he just agreed to apply for the funding. And he went through it with me when he did the application. And he said, okay, I should know within like 72 hours. And like 2 days later, he phoned me from his kitchen. I heard his dishes and kids in the background, and said that he was pleased to tell me that it was approved. And what he actually told me, I thanked him, and he said, thank you, because I didn't know I could get it approved in cases like yours. And now I'm going to try to do this for other patients. He didn't know that he could get funding for that drug for people who are IGHV unmutated, even though he works with a team of like the other doctors in the province. So he said he didn't know. And he thanked me, and he said, I'm going to try to do this for more patients in the future. So I thought, okay, great.
Well, I mean, I'm sorry that you had to be the person to fight for it, but I guess at least you know that you've made a big impact for everyone to follow, that you've helped to change this process. I mean, there's so many questions about how he would not know this to begin with, and what needs to change there, obviously, because the onus should not be on someone like you to have to figure it out. But looking at the bright side of things is, again, you've hopefully helped so many other people to
I
come.
hope so.